Olivia, thank you so much for joining us at Dome 360 today, our first integrated airway sleep breathing symposia. Very grateful to have you here.
Thank you.
Can you introduce yourself and tell us about your work?
Yeah, so I'm Olivia Lallouz. I'm a speech therapist by trade. I'm also a clinical researcher studying upper airway and neurocognition and swallowing. And then I'm also a qualified orofacial myologist. So a little bit about my work is it's kind of focused on the bird's eye view and the full picture of the downstream effects of airway and tongue posture. So, how powerful the tongue is in all the things that we do.
Well, there are a couple of terms there that you'll have to delve in a tiny bit deeper.
Yeah.
You mentioned myology. Can you tell us a little bit more about that?
So orofacial myology is this fancy word of saying we're going to retrain and I'm going to be your personal trainer for the muscles of your face and your mouth and your airway. So I'm going to give you all of these exercises and you're going to complete them to improve neuromuscular retraining, basically retraining your habits of your tongue posture, the way your tongue moves every time you swallow, and the way that you breathe. Improve your upper airway patency.
How do you communicate to the patient that these orofacial muscle movements, have, breathing and other, functional outcome?
Yeah. So I kind of tell my patients, I'm very focused on, I start at the tongue and I kind of say, okay, so let's say the tongue is the root of this beautiful flower that we're growing, right? So the tongue is the root of this flower and we can't continue to grow this flower through orthodontics, dentist, ENT, sleep. We can't continue to blossom if we're not getting to the root of the issue. And the root of the issue is the tongue posture, right? So if we're not fixing our resting posture, if our tongue's always resting on the bottom, we're always pushing our tongue through our teeth every time we swallow, things are not going to work. We're not going to have orthodontic retention. The teeth aren't going to look beautiful. Aesthetics aren't going to hold. And then the other thing too is you're not going to feel great because you're not going to sleep well.
How early? It's fascinating. You're able to communicate that to your patients. How do you convey that to the little kiddos? Or how young do you think we can start doing something for people?
Yeah, this is a pretty controversial topic in the field. I don't believe in baby myo. That's something called oral motor. In order for it to be true myofunctional therapy, you have to follow directions because you're retraining the muscles through progressive overload, right? It's kind of like if you were to go to the gym and I'm going to tell you, okay, you're going to do 5 sets of 10 squats. Same principle with the myofunctional exercises. If you can't follow the regimen and the directions, there's no purpose because the outcomes aren't going to be efficient.
So it's not really just limited to babies. I can tell you I know a lot of people, adults, who will not follow directions,
Right.
and so there's a big, shall I say, like a cognitive factor. Along mixed with these exercises.
Right. Yeah. I will give you the exercises and exactly the regimen. You don't have to memorize any of that, but you need to be able to follow the regimen precisely. And the other thing too is, I want this to become a part of your life. I want this to stick. I don't want this to just be, I'm going to do this at one point in my life, like a certain exercise program. I want this to be something that you bring with you every day, something that you're like, okay, I'm integrating. This is my lifestyle. This is a part of my wellness. This is how I sleep. This is how I breathe. This is how I keep my tongue. It's important.
You mentioned that as you do all of this, and they've already accomplished a lot, you're also pursuing a PhD degree. Can you tell us a bit about your research or direction if you have decided on that?
Yeah. So a lot of my research right now is primarily in patients with ALS, amyotrophic lateral sclerosis. It's a neurodegenerative disease that affects the upper airway, muscles of the face and the mouth, and especially the tongue. So a lot of our patients, there's 2 types of onsets of ALS. So there's spinal onset and bulbar onset, which are the 2 main knowns. There's other types of onsets as well. Bulbar onset is where the disease starts in the muscles of the face, the mouth, and the tongue. So myofunctional therapy integration is really important, and having this foundation is important to my research because right now my research is on improving physiologic airway defense through different types of cough training. And I actually just did a study on, we took a scope, we put it through the patient's nose, And then we had them do cough training to see if the upper airway collapse. The reason we did this is because often we kind of blindly set these pressures and the patient's like, I feel like it's not working, or I feel like I can't breathe after. And the purpose of the exercise is to improve breathing. We don't want this to be counterintuitive. So we're able to real time get visualization of the upper airway while the scope's in and doing cough training to prevent upper airway collapse.
And I mean, we've chatted, I do a lot of sleep endoscopy and just observing muscle, right, with endoscopic exam during function, be it cough or sleep, has been, just visualizing it has been super helpful. And well, totally fascinated with your work. Really look forward to hearing more. What's something cool and new that you think you'll roll out next, in the near future, whether it's clinical practice or scientific inquiry?
That's a tough question. I have a lot of different ideas right now, but I've been really into the idea of sleep and airway, of course. I really love my device, the company I've been working with, EMST, Expiratory Muscle Strength Training. So hopes to kind of roll out a research study at the clinic in the impact of expiratory muscle strength training and airway patency in adolescents and pediatrics. So again, shifting medicine to this more proactive than reactive approach. Let's not wait for the patient to not be able to breathe. Let's start when we see some red flags and some symptoms.
This is awesome. Thank you so much. Thank you. Thanks for joining us. And we look forward to chatting again. Thank you.
Thanks for having me.
Thank you.